Hi, and welcome to this special interview with the Canadian Donation and Transplantation Research Program, the CDTRP. My name is Stephanie, and I'm the CDTRP Communications and Events Manager. It is my pleasure to meet today with Julia King as part of the 2023 Living Donation Week. Julia is a living donor who has selflessly donated both kidney and liver as non-directed donations. She's part of the CDTRP Patient, Family, and Donor Partnership platform, actively participating in donation and transplantation research. Welcome, Julia. Thank you for taking the time to speak with me today.
Hello.
Can you share a bit about who you are and the path that led you to become a living donor?
Yeah, so I'm Julia. I'm 25 years old. I live in Vancouver and I'm a registered nurse in emergency. And I grew up in various parts of Ontario. And I ended up doing my donations in Toronto at UHN. My own journey as a donor started when I was 17. I joined the stem cell registry at that age. And then at 18, I started donating blood. When I was 18, I was in second year of nursing school. I saw a public appeal online about someone seeking a living kidney donor. I applied at the time, but in BC, you need to be 25 for anonymous donations. In December of 2020, one of my coworkers shared someone that they knew their daughter needing a kidney. I then applied again, but I was told again due to age, I had to wait. Through then, I got on the path of living liver donation. There's only two provinces in Canada that does living liver donations, Alberta and Ontario. And since I grew up in Ontario and I have family in Ottawa and Toronto, I decided to apply through Toronto. So I donated a portion of my liver summer of 2021 to a baby anonymously. And 7 months later, I donated my kidney to an unknown person as well through UHN.
Oh, wow. Such a great stories you have there at such a young age. That's amazing. Um, what advice would you give to individuals who are considering living donation? Is there anything you wish you had known before going through the process?
I would tell them it's an extremely rewarding process. You go through very extensive testing to be able to donate and that you're healthy enough to donate. For me, there were a lot of like highs and lows throughout the journey, but it's definitely the best thing I've done. Physically, I feel the same pre and post donation. And I think of it more as like it's a month or two out of your life, and then you can help improve someone's quality of life or help save someone else's life. The advice I would give to people is to join the mentorship program at their site. And it's nice to connect with someone who's donated and gone through the process. I didn't have a specific mentor for my liver donation, but I did for kidney. And it was amazing to talk to someone who understands the process and can help walk you through it. After my kidney donation, I started volunteering as a mentor, and it's been really rewarding. What I would say I wasn't really prepared for would be like how much it would impact my life. Now that I'm involved with UHN, the Center for Living Donation, the CDTRP, and BC Transplant, you get to meet like a lot of amazing people and throughout the transplant community.
So good. Um, and in terms of research, what areas of research or studies would you like to see with a focus on living donation?
I think I would like to see more long-term studies when it comes to donors, especially living donors. Most programs, they look at just less than 10 years. UHN, they'll now follow the donor for 10 years and just maybe looking into like more paired liver exchange programs as there isn't as many, and just expanding living donor programs to other provinces. Since I did have to travel from Vancouver over to Ontario. Another area I would say probably is donor mental health. During my kidney recovery, my mentor had passed away, and I struggled a bit with being an out of province donor and just finding the resources to support me during that time.
Wow. Um, All right, that concludes our interview. Thank you so much, Julia, for your precious time. It was truly an honor to sit with you and hear about your amazing story and always relevant viewpoint. Do you have any final words to share with our listeners?
I usually like to mention that people can get involved in other ways besides living donation. If it's not for them, they can become a deceased organ donor or just donating blood. Um, it's just amazing how like throughout the process after I started mentoring, I've had people reach out saying that they've decided to donate because they saw my article and become a living donor, which is it's really touching to me to see like the impact you can have on other people.
Amazing. I'll make sure to share this one as well. You may influence other people in a positive way. Thank you very much, Julia, once
Yeah,
again.
thank you.
And please make sure to subscribe to our YouTube channel to not miss any special features like this one. You can also visit our website at cdtrp.ca to learn more on the Canadian Donation and Transplantation Research Program. Thank you.